Well, at least in my view, that the right way to allocate money to research is on a scientific basis, not just on a political basis. What do I mean by that? I don't think we should decide how much money goes to particular research avenues based on who came into your office last. But instead, it should be based upon the incidence of the disease, the potential for cure, the consequence of the disease, and so forth. And on that basis, it's pretty clear that breast cancer and cancer generally are not getting their fair share. And so I believe that a scientifically based evaluation of where money goes suggests that you're going to see a great deal more funding for breast cancer and cancer generally. I also think we can do a better job, again, in the public sector for a moment. I spent my life first as a management consultant working with different companies, and then as a venture capitalist for about 15 years. And so I know something about research. And I know that sometimes dollars spent in research are sent to new buildings with people's names on them, and dollar after dollar, it's another building, and another building, and another building. I'd like to see a report that shows how much money actually went to the science, how much went to actual research instead of how much went to overhead and buildings. And the federal government is the worst when it comes to that. So put the money where it makes a difference in science. Next, communication between different research organizations. I would insist that if you're getting public funds, you communicate what you're doing and share that with the entire community so that we don't duplicate insurance again, and duplicate research. I also think there's a lot of potential for thinking creatively. And by that I mean not just thinking in the normal channels of traditional Western medicine. I let us see what's being done throughout the world and see if alternative therapies or alternative techniques have merit or not, and be able to communicate that to the people who are suffering from a disease. So public sector funding, clearly base it on science, not on politics, and spend it better. And then there's private sector funding. And a lot of money comes in from the private sector, as you know. And I know there's some people who, when they hear about pharmaceutical companies making profit, they say that's bad. No, that's wrong. Profit is not what goes out to the executives. Profit is after money has gone to the executives. Profit goes into research and development and growth. I like hearing that companies are profitable. It means they're going to invest in new technology and new science. And I want to see our pharmaceutical companies, again, investing aggressively in developing new techniques to bring cures. I want every person in this country to have health insurance. I will fight to get every person in this country health insurance. We can do it. It makes no sense at all for a country of our wealth and our capability to have people that don't have health insurance.